Miller. 1 in every 4 deaths in the United States is caused by heart disease. Coronary heart disease is the most common type. You may experience chest pain, lightheadedness, shortness of breath, or nausea as a precursor to a heart attack. While heart disease is the #1 health threat in the world, the good news is most heart diseases can be prevented with healthy lifestyle choices. How do you know if you're at risk? We'll find out more today on Doctors on Call as we discuss heart disease with our guest, Dr. David Battin.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Dr. David Battin received his medical degree from the University of Kansas Medical School. He completed his residency at the University of Kansas Medical Center in Wichita and his fellowship at the University of Tennessee Health and Science Center at William Beaumont Hospital. Dr. Battin is board certified with the American Board of Internal Medicine, Cardiovascular Disease, Nuclear Cardiology, and Interventional Cardiology. He is a member of the American College of Cardiology, Society of Cardiovascular Angiography and Interventions, and American College of Physicians. Dr. Battin joined the Mowery Clinic in Salina in 2010 and has clinical outreach locations in Abilene, Clay Center, and Concordia. Our phone lines are open at 1-800-337-4788 toll-free if you have any questions regarding heart disease on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us again this year, Dr. Battin. Let's get started with some of our questions. First of all, let's talk about COVID, get it out of the way, and how it's changed cardiovascular medicine.
Yeah, it's changed it a lot, actually, mostly in how we operate the day-to-day activities. You know, my field is largely procedurally based, and therefore we've really had to change how we approach the patient and how we deliver that care in the outpatient setting, and we've really moved to a lot of same-day discharges with our procedures, and I think in a lot of ways that's been a good thing, and it's certainly changed, you know, how we have to deliver care regionally and nationally in terms of bed numbers, but more importantly, staff numbers. You know, COVID has been extremely hard on staff, particularly nurses and other ancillary staff that just would get, you know, beaten up every day. And so, you know, we lost those members in droves at times. So it's a real issue, it's a real problem, and there's been a number of times throughout the course of, you know, a couple years where there's not either been beds or staff to take care of people, and they're flying people across state lines to get care for not just COVID, but heart attacks and strokes and other emergencies.
I might ask how that Mowery Clinic is handling that, the stress and trying to keep the staff healthy while you're trying to help other people.
Yeah, I mean, you know, it's been a process that has evolved a lot, right? I mean, you're dealing with, at the start, imperfect information, and you're just trying to make the best decision that you can with the information that you have, and that evolves. It's very organic, and what we know today is way different than what we knew a year ago, which was way different than what we knew, you know, a year before that. And you know, we've just tried to evolve and adapt with it, and you know, starting out with the mandatory masking and cleaning in between patients and offering telehealth visits, and a lot of those things are still present today in the clinic. at least they're offered. I think we need to move past a lot of that now. COVID is here to stay. It's definitely not going anywhere. We all have our choice whether how we want to manage that and how we want to mitigate against that. But we really need to get back to normalcy, and I hope that that's going to be underway. But I think we're always going to have flare-ups and whatnot.
Sure. Let's talk about the Mowery Clinic as well and what's going on new in the cardiovascular department.
Yeah, I think the structural space is the space that's evolving the most rapidly, and what I mean by that is how we manage valve disease, for example, aortic valve disease and mitral and even tricuspid valve. It's moving away from large open operations and more to percutaneous operations or procedures that go through, say, a leg artery or arm artery or whatever. And over the last year, we've had the transcatheter aortic valve replacement option as part of our valve clinic and structural heart clinic in conjunction with Salina Regional Health Center. And we just completed I believe our 51st transcatheter valve today.
How successful has that been?
I think it's been great. Honestly, it's been awesome for the patient. It's been awesome for the community and the program, and being able to offer that in our region, and patients don't have to travel sometimes, I don't know, 200 miles to get it done. I mean, most frequently it'd be, 90 miles would be kind of the average that they'd have to go from Salina. But, we take care of a lot of people north of Salina, the, Concordias and Beloits of the world, and, traveling to Kansas City or Wichita or Lincoln or wherever. Before that was, sometimes pretty stressful for elderly individuals, and so it's been great. And the other, we're in, I think, probably our third or fourth year of the Watchman, which is another structural piece for patients with atrial fibrillation that allows them, it's a mechanical way to get off anticoagulation to prevent stroke. And we've completed our we're over 350 cases at this point, so yeah, it's been great.
You've been busy. Okay.
Generally.
Yeah. So what are some of the types of heart disease?
So heart disease is a generic term to describe diseases of the blood vessels that supply the heart, such as coronary artery disease, disease of the heart muscle, such as congestive heart failure, or disease of the valves like aortic stenosis or mitral regurgitation. Those would all be examples of heart disease.
And what are some red flags that a person might be having that might be indication that they have heart disease?
Sure, it's gonna vary across a spectrum, but generally when people start to develop insidious, like exertional type problems that occur over several weeks or months, such as shortness of breath when you start to do things, and you normally could do those things very easily, but as you reflect over a period of time, wow, it's really gotten hard to walk across the parking lot at Lowe's or Dillon's or whatever. I think that one encompasses a lot of different types of heart disease. Shortness of breath, you may experience chest discomfort, dizziness, lightheadedness, exertional type fatigue, weight gain, fluid retention in your feet or ankles. I think that would be common to see across a large variety of heart disease.
And when might a patient need to go to the emergency room? When might they say, I just want to wait it out and see in the morning how I feel?
Yeah, so patients are often surprised by the acuity that can occur with heart disease. It is, of course, not at all surprising to me or my partners, but you're good until you're not. And any kind of abrupt onset of chest discomfort, chest tightness, abrupt onset of shortness of breath, if you're sitting here and we all of a sudden become short of breath, that ain't right, and you need to go get it checked out now.
We talked a little bit in the intro about preventing heart disease. Let's talk about that prevention.
Yeah. So every year it's the same thing, right? Don't smoke. If you had a list of 10 things not to do, the first 9 would be not to smoke. So detrimental to the heart and vasculature. Anytime we do that, we accelerate basically every disease process that we know about. And it's the one thing that once we identify heart disease, we really hit hard to try to reduce, because it can have the most benefit as far as long-term survival. No matter anything else that we do, meds, diet, etc., quitting smoking has the most benefit. Outside of that, it's maintaining ideal body weight and trying to maintain a healthy lifestyle with exercising 30 to 40 minutes a day most days of the week, moderate type activity, healthy eating, more white meat, less red meat. I'm super guilty of not following that like most Americans, but more fruits and vegetables, less refined type breads, and more kind of the whole grains and nuts and salads and those good things.
What kind of exercise do you find is best? Does it have to be, can it just be walking, something as simple as walking? Does it need to be more high intense?
No, it doesn't need to be more high intense. You just need to get up and move, fundamentally. We describe it as moderate type activity, but a lot of people, their moderate type activity is walking, and until your body kind of adapts to that new normal, then moderate activity, can't progress, right? So if you've been used to being at rest forever and ever, well, you might get your heart rate up to that 65% of what we would predict you to be at for your age with walking for 40 minutes. So you really kind of have to gauge and figure out what it is for you. But for others, it'd be jogging or riding a bike or swimming or rowing or whatever you're into, yoga, all good things.
Sure. Okay, we want to remind our viewers that we are talking with Dr. David Battin about cardiovascular health, heart disease, tonight on Doctors on Call. That number is 800-337-4788. Right now we're going to go to the phone lines. We've got Lindsay on the line from Hayes. Hi, Lindsay. Go ahead with your question for Dr. Battin tonight.
Yes, I've been told that there's a blood test you can have drawn that tells you the likelihood of you having heart disease. Is that accurate?
So for those where we're trying to, prevent, you don't know that you don't know if you have heart disease, and everything's been great. And so from a primary prevention standpoint, there are a battery of tests that we use to try to assess your likelihood of developing heart disease in, say, a 10-year time frame. And we use that in conjunction with your age, your sex, your blood pressure, whether you're diabetic, whether you smoke, whether you're on meds, whether you're not. And we can check cholesterol and different lipid particles, and different blood tests like a highly sensitive C-reactive protein or the presence of a lipoprotein a, which you don't need to know what any of that means. But we use all of that to kind of assess what your 10-year risk would be and whether or not you need to be on more intense medication to help prevent a heart attack or stroke, or to prevent heart disease. But I would say, is there a singular test? And the answer is no. There are a lot of different genetic tests that are being done for a lot of different disease states. But they're not perfect, and they're not particularly helpful right now. I think something like that will be available. I believe it absolutely will be available at some point in our lives, but I'm not aware of a singular test that would tell you you're going to have coronary disease.
Okay. Thank you for the information. We're going to go back to the phone lines. We've got Mark on the line from Lyons. Hi, Mark. You are live on the air. Go ahead with your question.
Okay. Well, I had an aortic valve put in a couple years ago, and then I also had to have a pacemaker put in. And just fall, I started having some problems, just not feeling good and everything. And they said it was AFib, and basically learned to live with it. And I just wondered, they didn't really explain to me very well what AFib was.
Okay.
So I just...
Okay. Yeah, so atrial fibrillation is a rhythm disturbance that occurs in the top chambers, usually on the left side in the left atrium, around what we call the pulmonary veins. And it's kind of a, it's a chaotic rhythm disturbance, and most of the time it's a nuisance, okay? There's a couple of issues with atrial fibrillation. Number one, it can increase your risk for stroke, and so you have to, assess your risk for stroke and have a conversation with either your primary care doctor or your cardiologist regarding your need for anticoagulation. And then the other thing that has to happen is to make sure that your heart rate is well controlled, that it's, that you have a resting heart rate, ideally less than 100, and somewhere around 80 would be the best. Patients with atrial fibrillation can be quite symptomatic, or they could not have any awareness at all as to the presence of the rhythm disturbance. If you think your symptoms are related to that, if you noted a change in how you felt when you went into it, then you can always have a discussion regarding your options of trying to eliminate that rhythm. It's not easy. As far as the process, it usually involves a cardioversion, which is, that's easy, but it is a procedure done with some level of anesthesia, and then going on medications to try to stay in the normal rhythm, and then you usually accompany that with a visit to, say, an electrophysiologist, which is a cardiovascular specialist that deals with the electrical pathways of the heart, and talking about ablative strategies. And I'm really getting into the weeds here, but I hope that gives you some direction.
Sure. How do you feel about the advice that he had been given that he was just going to have to live with it?
I wasn't there,
Okay.
first of all, and I don't know, any of his background, all these caveats, age, etc., or onset. But I don't like it.
Okay. All right. Fair
fundamentally.
enough. Fair enough. He had mentioned a pacemaker. Who is a good candidate for a pacemaker?
Well, so patients that get pacemakers usually have some intrinsic rhythm disturbance that requires one. It's not necessarily something like, I can't wait till I get my pacemaker. It's something that usually evolves over time as a result of the wires in the heart getting too much calcium around different parts of the heart, or the wires kind of break down or whatever, and you develop rhythms such as heart block, where the top chambers and the bottom chambers are no longer communicating, or the sinus node just decides it wants to quit working for 6 or 7 seconds or whatever. And that can result in someone passing out all of a sudden, or if it occurs in the setting of, say, heart block, and your heart rate's really, really low, it can make you feel really bad. Well, in that case, a pacemaker is super helpful to those individuals to get them back to their quality of life.
Okay. Back to the phone lines we go. We've got Gary on the line from Dodge City. Hi, Gary. You can ask your question now.
Okay.
You are live on the air. Go ahead, Gary.
My question is this. I just had a stress test by my heart doctor here in Dodge, and they said I have some blockage in the lower, my lower heart. And now he wants to do a different test to go up through my groin, and I'm trying to figure out, if they find something, what's the next step? Because I'm 83 years old.
Okay. So, I think the first thing you have to ask yourself is, why was the test done? What kind of symptoms were you having that led to that test? And if the procedure that you're going to have next can help do something to make you feel better, so that your quality of life has improved. So the next test that they're talking about is a cardiac catheterization, where you insert a tube either in the leg artery or more commonly the wrist artery these days. And through that tube, you move other little tubes up to the heart. And using the X-ray equipment and the dye, we inject this contrast into the heart arteries, and that gives us a black and white digital movie of your heart arteries. And so we can see the blood flow going to the heart by doing that procedure. Now, the stress test that you had, you suggest, or the doctor suggested to you, that there's a suggestion that there's a lack of blood flow to the bottom side of the heart. So in one of those arteries, perhaps, there may be a tight narrowing, usually a 70% stenosis or greater. Stenosis is a narrowing or restriction in blood flow. And what they would do if they saw that would be to try to place a stent in there. A stent is glorified chicken wire. It acts as a scaffold to prop the vessel open. It stays there, it doesn't go anywhere, it'll be there forever. It will require that you take a couple medications for a short period of time. But the idea in reestablishing blood flow in that heart artery is to improve exertional type symptoms. So if those aren't your problems, then those are the questions you need to ask.
Does high blood pressure relate in any way to heart disease?
Yes.
Okay.
High blood pressure is a risk factor for different heart disease, heart failure and coronary artery disease. Definitely you want to have good control of blood pressure to prevent progressing to those types of problems.
What kind of blood pressure medicines are on the market right now?
There's a number of options for blood pressure control. We have oh boy, try not to go too far out there, but medications designed to attack the different hormones that are secreted by the kidneys that raise the blood pressure, and then different medications designed to help eliminate salt in water, as those hormones can increase our retention of that salt in water, kind of a dry hypertension versus a wet hypertension. And medications that relax or dilate our very small blood vessels in our distal extremities to help also lower blood pressure. I think those would be kind of the typical types of blood pressure agents that we'd see.
Sure. And at what point does a patient need to highly consider being on medication?
I mean, when you're checking it at home, it needs to be 130/80 or less. You need to be sitting down for 15 minutes not doing anything. When you come off the street and you go into a doctor's office, white coat syndrome is very real. Treating it off of a single number is probably not the right thing to do. I think it's better to have a vault of data, either written down or stored in some sort of device, where you just check it, once a day, vary the time of day, but make sure you haven't been doing anything.
And what are some of the symptoms of a stroke?
So patients that have a stroke usually have typically unilateral weakness, like right arm or right leg weakness. They may have trouble with vision, may experience something like a shade. Oftentimes a shade is being pulled down. Part of their face, they may lose the ability to smile in part of their face, and it can be quite variable, but it's usually localizing, meaning that you can one part of this body or one part of this body.
Sure. And what are treatments if a person has had a stroke?
A lot of the treatments are aimed at the vasculature, so there's a lot of crossover in terms of what you would expect from heart disease. You do a lot of the same therapies for those that have had a stroke. So there's different types of stroke. Ischemic usually is a result of an unstable plaque in a neck artery that breaks free, and you get a local blood clot there that stops blood flow. And that'd be more of your traditional kind of aspirin, statin, blood pressure lowering, smoking cessation kind of thing. There's embolic stroke, so a blood clot or something originates at a different part of the body. For example, the heart, in patients with atrial fibrillation. If you're not on blood thinner, you don't know you have it or whatever, blood clot can form in the left atrial appendage and then be ejected and go to the brain. It could fundamentally can go anywhere and go to your arm, your leg, your gut, whatever. But that would be a different therapy because that's a different problem. And then of course you have bleeds that are also referred to as strokes. Again, a very different therapy.
Okay. Well, our thanks goes out to Dr. David Battin from Salina for being our guest on Doctors on Call. Our next show, we'll be discussing weight loss. You can email questions for our next program. That address is doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.